Good morning. I'm Dr. David Pedler, Scientific Director of CIMVHR. Welcome to the Sex and Gender Symposium, the second of our 4 symposia being held throughout the month of October. Before we begin, let's acknowledge the Indigenous peoples of all the lands that we are on today. While we are meeting virtually, I would like to take a moment to acknowledge the importance of the land which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. I will now invite Dr. Stephanie Belanger to say a few words. Thank you.
Good day and welcome to the Symposium on Sex and Gender. Je suis Stéphanie Bélanger, professeure au Collège militaire royal du Canada, fondatrice et directrice scientifique associée de l'Institut canadien de recherche sur la santé des militaires et des vétérans. It is an honor for the Canadian Institute for Military and Veteran Health Research to be hosting this symposium with the great support of Dr. Maya Eckler, Canada Research Chair on Social Innovation and Community Engagement at Mount St. Vincent University. Nous espérons que vous pourrez participer aux discussions et nous allons d'ailleurs accueillir des questions dans les 2 langues officielles. C'est un privilège pour moi de céder la parole à l'ambassadrice Jacqueline O'Neill. I'm very pleased to welcome the Canadian Ambassador for Women, Peace and Security. Enjoy this panel.
Thank you, Stephanie, and good morning, everyone. Very early good morning to everyone joining us from Western Canada. Bienvenue à tous et à toutes. Je m'appelle Jacqueline O'Neill et je suis l'ambassadrice du Canada pour les femmes, la paix et la sécurité, et je suis votre modératrice. So some of you may be wondering why I am facilitating. And perhaps I can best answer that question by describing this concept of women, peace, and security. So it became a term about 20 years ago when women from around the world were advocating to the Security Council to take seriously the idea of women in war and peace. And essentially what happened is that they had very similar experiences during conflict. So they were combatants. They had been in communities urging parties to go to negotiating tables. They were preventing the worsening of fighting. They were reintegrating combatants. They were returning from fighting forces themselves and trying to reintegrate. And when it came time for formal negotiations, they were almost wholly excluded. There was almost no data at the time, but they knew their lived experiences. So they took this issue to the UN Security Council and asserted that they were not just victims of conflict, but they were agents of change who play active roles in all aspects of war and peace. And they sparked some of the first gender disaggregated research on peace negotiations. And you would all just cringe at this methodology because, as I noted, the researchers were not looking for things or people were not documenting these issues. So researchers had to look at photos of signing ceremonies or actual names of signatures on documents and triangulating any way they could. And of course, the research confirmed that women were dramatically underrepresented. So for about 25 years leading up to the last 25 years or so, 40 major peace processes, women comprised about 2% of signatories, or about 8% of negotiators. So they got this very significant resolution passed at the Security Council called 1325. There have since been 9 more. There are 85 countries with national action plans, including Canada. We're in our second now. Our first was launched in 2011. And one of the aspects I'm most proud about our National Action Plan is that it has both an international and a domestic focus. So our lead partners are Global Affairs Canada, Department of National Defense, and the RCMP, and they're joined by Public Safety, Justice, Citizenship and Immigration, Women and Gender Equality, Indigenous Services Canada, and Crown Indigenous Relations and Northern Affairs. So women, peace, and security is not the idea that women are inherently more peaceful than men or that men are inherently more violent. And it's not a zero-sum approach to thinking. So focusing on women, for example, does not mean diminishing the roles or experiences of men. But it is the idea that all people deserve to have a voice in decisions that affect their lives and that individuals and institutions, including every part of our government, has a responsibility and an interest to remove barriers or explicitly or implicitly prevent them from doing so. And a key part of this is recognizing that being quote unquote gender neutral, meaning having a blanket policy or approach that says this applies equally to everyone, is not enough, because sex and gender identity can significantly inform people's lived experiences. And we need to be intentional about it to ensure their inclusion. So I'm just delighted to be part of today's session. I know many of you have worked on these issues for many years, and some of you are newer to this specific question. And I urge all of you to be active participants. So reflecting how this relates to your own research, and by asking questions and making comments on the YouTube chat. So I've worked on this stuff long enough to know that it can sometimes be a challenging topic because the overwhelming majority of people believe in gender equality and want to advance it, and don't want to say or do something that might get them labeled as, the opposite of that. So I want to note that this is a space to ask respectful questions, and especially if you don't get some of the jargon or vocabulary or concepts, just ask. And I urge us all to keep in mind that this work is not binary in the sense that you're not either doing it right or doing it wrong. It's a process, and the more we understand the barriers that exist, what works to remove them, etc., the better we'll be. It's a process, and there's always much more to learn. It's also a subject that can evoke strong responses. And so I'll note that there's a social worker from the Canadian Forces Health Service Group available to speak by phone, and her contact information will be available in the chat room. So this morning we have 3 presenters, each of whom will give about a 15-minute presentation. And after each presentation, the presenter and I will have a 10-minute discussion during which I'll ask questions that you've posted to YouTube. And then finally, for the last half hour or so, the 4 of us will have a discussion together. And again, I'll incorporate your questions. And you are, of course, welcome to submit your questions in English or French. Comme Stéphanie avait dit, vous êtes invité de poser vos questions en français ou en anglais. Alors, allons-y. Our first presentation is by Dr. Maya Eichler on sex and gender tools for CIMVHR researchers. Thank you.
Hello, and thank you for tuning in. My name is Maya Eichler. I'm an associate professor of political studies and women's studies at Mount St. Vincent University in Halifax. I also hold the Canada Research Chair in Social Innovation and Community Engagement. And it's my great pleasure today to talk to you about sex and gender tools for CIMVHR researchers. My main objective is to share with you why sex and gender should be part of the toolkit of every defense researcher, including CIMVHR researchers. And then I want to offer you some practical suggestions for integrating a sex and gender lens. Over the past 3 decades, there has been a huge increase internationally in sex and gender research on military and veteran issues. This research has taken different approaches, from a focus on women to an examination of sex and/or gender differences to the study of particular subpopulations of women, as well as research on masculinities and gender norms. It has also included a wide range of topics, from mental and physical health to military sexual trauma, employment, education, homelessness, and much more. And on my PowerPoint slide, I have provided you a link to a scoping review a collaborator and I did a couple of years ago that looks at the sex and gender research on military and veteran issues. My own work is very much part of this growing international body of sex and gender scholarship. My research is based in a feminist social science approach. I do mostly qualitative work on military and veteran issues, including on gender integration in the armed forces, military sexual violence, and the role of gender in military to civilian transition. My research has been funded through the Government of Canada, primarily the Social Sciences and Humanities Research Council, the Canada Research Chair Program, the Canada Foundation for Innovation, as well as through D&D CAF and VAC contracts. My research is also informed by ongoing participatory engagement with the veterans community, such as my research partnership with It's Just 700, one of the organizations of Canadian military sexual trauma survivors, or in my work as co-chair of WREN. WREN stands for the Women Veterans Research and Engagement Network. It brings together researchers, military and veteran women with lived experience, and veteran advocates to promote research and evidence-based policy for military and veteran women, with one of the key goals being to ensure that women veteran voices are included in research on women veterans. So sex and gender research has been growing here in Canada and internationally. But the main point I want to make in my talk today is about the importance of mainstreaming a sex and gender lens throughout all defense research, with implications for policy as well. So my main takeaway is that sex and gender should be considered even if one's research doesn't explicitly focus on sex and gender. For the rest of my talk, I will explain why I think this is important and how it can be done. But first, I want to talk to you a little bit more about sex and gender terminology. It is important that we have a shared vocabulary to talk about sex and gender issues. First of all, I want to make the important point that sex is not just about adding more women into research. Of course, including more women is an important first step because they have been underrepresented in earlier research. But it is not enough to do that as women's distinct experiences and needs may still remain invisible. Therefore, we need to integrate a sex and gender lens. Too often, sex and gender are conflated, however, or not well defined, even in sex and gender research, which causes problems, for example, when we want to compare findings. Now, there is a recognized shared vocabulary out there, established, for example, by the Canadian Institutes of Health Research. According to this shared vocabulary, sex is about biological attributes, while gender is about social norms, roles, and identities. So sex refers to biological classification as male, female, or intersex. It is based on anatomical, hormonal, chromosomal, and genetic distinction. Gender, on the other hand, refers to sociocultural norms, behaviors, and roles associated with masculinity and femininity, as well as non-binary gender expressions, such as gender fluidity, two-spirit identity, or any combination of masculine and feminine or otherwise. It is also important to keep in mind that sex and gender interact in a large variety of ways. Often, it is important in research to consider both sex and gender and their interplay. For example, gender is a social construct that is attributed to individuals on the basis of perceived sex, but individuals may or may not identify with their assigned birth sex. Or to give you another example, biological risk factors may be amplified by gender norms or the lack of sex-specific services. It is also important to keep in mind that sex and gender are very much an evolving area for research and society more broadly, and that our terminology may change over time. My main takeaway here is that sex and/or gender need to be defined and carefully used. As much as possible, I think we should try to use these terms and concepts in ways that is consistent with recognized and shared understandings, such as those provided by CIMVHR. Being explicit about how researchers use these terms is important, especially in order to be able to compare findings when we're doing scoping reviews or meta-analyses, for example. Now, why is it important to integrate sex and gender into military and veteran research? The military is a sex and gendered institution. It has historically been designed primarily around male soldiers and the privileging of masculinity. In addition, the military exists within a society that is gendered, that is characterized by gender inequalities and prevailing norms of masculinity and femininity. But the military population today is more diverse than ever. Take, for example, women, the largest minority population within the Canadian Armed Forces. They make up approximately 15% of the military and veteran population today. One of the key problems we encounter is that past historic research on military and veterans has often not disaggregated its findings by sex or gender. So for too long, the implicit assumption has been that studying veterans means studying male veterans. Often we don't even know how many women versus men were included in a study that uses the generic or gender-neutral term soldier or veteran. Therefore, it's often impossible to know whether the findings are applicable to both men and women. Women's military experiences and their experiences as veterans are in many ways similar to those of men, but they are also distinct in significant ways. It is well established in the international literature that service women and women veterans face heightened risks for sex-specific injuries and illnesses as a result of occupational contexts and hazards. For example, specific urinary and reproductive problems. We also know that mental health problems present in sex and gender-specific ways. Women are also more likely to experience military sexual trauma, which often leads to a host of ongoing, often chronic health problems. Physical health issues such as chronic pain are also higher among veteran women compared to men. We also know that women veterans face a greater decline in income than men after leaving the military, and that there are gender-specific employment patterns that they experience. These are just a few examples from the literature, the international literature, as well as the Canadian research literature. And my main takeaway here is that allegedly gender-blind or gender-neutral research will likely not make these distinct experiences visible and could have unintended negative consequences, leading to inequitable outcomes and potential harm. Therefore, I believe that if a study includes only male veterans, it is imperative that it be clearly labeled as such. The same holds true for studies on military spouses, for example. If only female spouses were studied, this needs to be explicitly stated in order to avoid a conflation between women and military spouses. Now, what can be done to address some of these historic blind spots and biases? I want to share with you some sex and gender tools that are out there and that CIMVHR researchers can draw on. Some, or maybe many of you, will be familiar with these. The first one is Gender-Based Analysis Plus, or GBA Plus. The plus calls for consideration of how the effects of sex and gender intersect with and may be exacerbated by other individual or structural factors rooted, for example, in socioeconomic class, race, ethnicity, sexual orientation, indigeneity, relationship or marital status, age, and more. This is referred to as intersectionality, which is another important concept in the context of sex and gender analysis. Gender-Based Analysis Plus, or GBA Plus, is a mainstreaming tool that helps ensure that all policies and programs are inclusive and do not have unintended downstream effects on women, men, non-binary, or gender-diverse people across intersectionalities. GBA Plus is used across Government of Canada departments, agencies, and funding bodies. And today, policy and programming at VAC and D&D CAF are also expected to undergo GBA Plus. On the PowerPoint slide, I have included a link to a GBA Plus online tutorial. The second tool is Sex and Gender-Based Analysis, or SGBA, which has been a standard practice at Health Canada for more than 3 decades. The purpose of SGBA is to enhance research by being explicit about who is being included and excluded in research, making biases and blind spots visible, and by accurately representing the scope and generalizability of research findings. Now, similar to GBA+, best practice for SGBA includes considering sex and gender within an intersectional framework. CIMVHR has a host of online tools for researchers, and again, I provided a link on the PowerPoint. And finally, Sex and Gender Equity in Research Guidelines, or CIMVHR guidelines. These are international guidelines for academic research and peer review. They are considered current best practice to be followed for science publishing and grant funding across many disciplines today. So these are a set of guidelines on how to report research findings, with the goal being to make it routine practice to report sex and gender specific analysis of research data. If you go to the link that I've provided on the PowerPoint, on page 8 of that link, you'll find a checklist for authors on sex and gender aware reporting with a list of guiding questions. I want to just mention a few key principles now. CIMVHR guidelines recommend that authors should use the term sex and gender carefully in order to avoid confusing or conflating the terms. Research should be designed in ways that can reveal potential sex-related and/or gender-related differences or aspects, even if that is not the main objective of the study. And ideally, studies will be designed from the get-go to address sex and gender, but where this has not been done, the lack of a sex and gender lens should be explicitly stated as a limitation. My main takeaway here is that there are a robust set of sex and gender tools that already exist and that researchers can draw on. In conclusion, today there is growing recognition about the potential problems of seemingly gender blind or gender neutral, or for that matter, intersectionally blind or intersectionally neutral research and policy and the potential harm it can do. But I also think there's a collective will to work towards removing historic biases and blind spots. This is why the Government of Canada has adopted tools such as GBA+. This is why Health Canada uses SGBA, and why researchers are increasingly expected to apply CIMVHR principles. There is also growing recognition that one size doesn't fit all. The population of military members, veterans, and their families is diverse, and therefore it is more important than ever to mainstream a sex and gender and intersectional lens into all military and veteran research and policy and programming. This means carefully using terms such as sex and gender, but also being careful about how we use words such as veteran or spouse. This will help us produce more inclusive research, I believe, that can provide a robust foundation for policy and programming, which can address the needs of all veterans in equitable ways. Thank you for your attention, and I look forward to your questions.
Thanks, Maya. That was excellent. It was very clear and especially practical. So thank you. I wish I could show that video at the start of virtually every meeting that I'm in. So as questions come in on YouTube, I want to just first start to pick up on a few of your points. And first I want to ask, is there an example or two that come to mind where you find it particularly striking what might have been lost or overlooked if you were another researcher had not paid attention to sex and gender?
Yes, one of the examples that comes to mind and is really striking for me is around veteran homelessness. So we know, for example, from the US research that women veterans are one of the fastest growing segments of the homelessness population. And in Canada, we know that women veterans face significantly higher rates of episodic homelessness compared to women in the general Canadian population. And what's really important to look at in terms of sex and gender in relation to veteran homelessness is to look at the different paths into homelessness and the different needs that homeless veterans have. So we know that trauma and homelessness often go hand in hand. But for women veterans, that looks quite different. It's most often non-combat trauma, so military sexual violence, intimate partner violence are correlated with risk for homelessness. We also know that women who are homeless, women veterans, have different needs. I was struck by one US study that showed that 1 in 3 women veterans in the US had dependent children with her. And so, you know, shelters needed to accommodate that, but often were not equipped to do that. And, you know, we also need to keep in mind sort of the history of or experiences of institutional betrayal that might keep, for example, women veterans from seeking out veteran-specific services. And I think intersectionality is also really important to keep in mind in the context of veteran homelessness, because we know, and this is true for Canada as well as the US, that women veterans are more likely to be single compared to men, so they don't have immediate family and social support. We also know that socioeconomic factors are quite different. So women veterans face a steeper decline in income, have lower labor force participation rates. So it's really quite a complex issue. And without a sex and gender lens, you wouldn't fully understand both the paths into homelessness, the needs, as well as paths out of homelessness. And so I think any sort of veteran homelessness research as well as strategy around prevention, you know, it needs to integrally include a sex and gender lens.
Clearly, thank you. So you talked a lot about mainstreaming sex and gender into research. And I think mainstreaming is a term that's used a lot, but it's not always clear exactly what it means. I think we've all sat around tables and everyone agrees the next step is to mainstream something, and no one knows quite what the next step actually would practically be. So can you help bring that alive in a research context? What kind of things does it mean you're doing, and what does it mean that you're not doing when you're mainstreaming sex and gender?
Okay, maybe I'll start with what are you not doing? So I think ideally, we don't want to add sex and gender sort of as a checkbox at the end of a research study. That's usually too late to consider sex and gender. What we also don't want to be doing is trying to include more women into research that's really premised on the experiences and needs of male veterans. So instead of that, ideally what we want to do is kind of consider sex and gender right from the get-go. So this means thinking about the kinds of research questions we're asking. You know, has sex and gender been considered in the development of the research question? Or is there a way in which it's maybe obscuring sex and gender? Is there a different way we can formulate a research question? Have diverse gender perspectives been considered in the development of this research study? You know, and then I think it's all about kind of mainstreaming sex and gender throughout the research process. So looking at, you know, data collection, who is collecting data? Is sex and gender of the person collecting data perhaps informing the kind of data that's being collected? Is data being collected in a way that potentially can reveal sex and gender differences? You know, can it be sex and gender disaggregated? And then analysis is kind of the next step, where you could integrate a sex and gender tool, thinking about whether your analytical tools are well equipped to recognize sex and gender. And I think, you know, that kind of process of sex and gender mainstreaming ideally continues even further when we're thinking about how to present our findings. I mentioned the sex and gender equity in research guidelines. Those are really useful in terms of thinking about how to present in a way that, you know, findings in a way that reveals sex and gender. But then also thinking about implementation and recommendations, you know, and I think, you know, it's useful to think about what are the implications of our findings and the recommendations, who might benefit, who might be disadvantaged. Can we find meaningful ways to include the voices of those with lived experience in the implementation and in the development of recommendations and policy? So that would be my response to that.
Thank you. We have a question from the YouTube channel. In your opinion, what specific priority changes should the Canadian Armed Forces and our Veteran Affairs Canada implement to address some of the systemic gender inequalities identified?
Well, I think, I mean, we're talking mostly about research here. So I would say that, you know, Veterans Affairs Canada has now officially adopted SAGA principles. Their Director of Research, Nathan Swenson, mentioned that in in a webinar a couple of weeks ago. So I hope that the Canadian Armed Forces will follow suit. I think that's a really good first step to get started. And I think, and this is sort of about the connection between research and policy. I think the research we do has real implications for policy. I think we all agree today that we want to develop policies that are based on good evidence, right? And so good evidence means evidence that that is as inclusive as possible, or at least recognizes its own limitations. So I think the first thing is to integrate sex and gender into research so that we have solid evidence. Because if we don't know what the needs are, what the risk factors are, I think it's hard to develop good policy.
Indeed. All right, thank you. We're gonna, if you don't mind, put you on pause for a second and bring you back when we have our group conversation. So thank you for that.
Thank you very much.
Yeah, appreciate that. And we're going to turn now then to Dr. Jennifer Lee, who's going to talk to us about research at D&D and CAF. Jennifer.
Good morning. My name is Jennifer Lee. I'm Acting Director of Research on Personnel and Family Support under Director General Military Personnel Research and Analysis, or DGMPRA for short, at the Department of National Defense. I'm really honored to be able to speak to you today about some of the research that we've been doing specifically on the topic of sex and gender in the CAF within the CAF D&D. So without further ado, I will get started. So exploring sex and gender in our research is something that's become increasingly important within the D&D CAF, out of recognition for the importance of promoting diversity and inclusion in the forces. Indeed, diversity and inclusion is one of our strategic priorities, mainly as an effort to ensure that the CAF is reflective of Canadian society and the values of respect, fair treatment, and inclusion for all military members. So a lot of this push has related to the broader Government of Canada's direction towards the adoption of gender-based analysis plus to ensure that the policies and programs that we develop factor in the needs of diverse individuals. But another catalyst, especially for the CAF, is our objective to increase the representation of women to 25.1% by the year 2026. So as a result, we've been making efforts to examine sex and gender aspects among military personnel across all the phases of the military career, from attrition and recruitment all the way out to transition out of the CAF and adjustment to post-military life. In this presentation, I'm going to be covering a few insights that emphasize the importance of exploring issues from a sex and gender lens. But rather than focusing on all of the work that we've done in this area, I'm going to provide a closer look on only a few topics that mainly center on the middle three aspects of the military career, namely workplace well-being and health, family well-being, and retention and attrition. But before I begin, I'm going to clarify that as social scientists at DGMPRA, a lot of work that we've done in this area has been on samples of CAF members that we've generated to be representative of the CAF in terms of biological sex using our administrative data sources. However, we have tended to base our analyses on participants' stated gender in these projects. So it's just something to keep into consideration as we go forward in the presentation. So given our interest in increasing the representation of women in the CAF, we've taken a great deal of interest in understanding what factors contribute to decisions to stay or leave the CAF. The CAF retention survey is our signature tool to assess these, and it was administered the last time in 2019. Interestingly, our analyses of gender differences has shown that there are certain areas where there's actually relatively minimal differences between men and women, such as their attitudes about various work and organizational outcomes. However, when we drill a little bit deeper into this, we see that there's important differences in terms of perceptions on what would encourage men and women to stay in the CAF. So specifically, we see here in the figure that while men are more likely to report that increased pay would compel them to stay in the CAF, women are more likely to report that there's improved support for family, improved career progression, and improved workload and demands are things that would compel them to stay. So these results really emphasize the fundamental differences that really need to be considered when developing a strategy that can improve the retention of calf across the board. So in terms of our attrition data, we've generally focused on examining differences by sex, as these are based on administrative data. Here we'll find that while there have been no overall sex differences in attrition when we consider the past 20 years or so, the factors contributing to attrition have differed between men and women. So specifically, among men, attrition tends to be more likely to be voluntary, whereas for women, it tends to be more likely to be based on medical reasons. So along with some of the results of our retention survey, these findings really show the value of further exploring sex and gender aspects of things like workplace health and well-being, and also family-related well-being when it comes to the military career. So I'm going to be exploring a couple of studies that have focused on these two aspects of the military career. So we saw earlier, the retention survey data emphasized that women place importance on the support they can have for their family as something that the CAF could offer them. This observation in a lot of ways is supported by our research on the well-being of military families. In our study on the impact of military life on single parents, we found some interesting nuances, however, when we compared the experiences of men and women in this regard. Specifically, we saw that single parent men, they tended to report more issues with work-family conflict and concerns related to the impacts of postings on the family. However, single parent women were more concerned about the impacts of deployment on their family, and they also felt guilty about the impact of their family life on their work life, as opposed to the converse, which was for men. So these observations also line up with some of the topics that were raised by the 300 plus women who participated in our qualitative interviews or focus groups for our study on the perceptions of women on the attraction, recruitment, employment, and retention of women in the CAF. Among a range of different factors, some of the things that women discussed were their perceptions of insufficient flexibility for child family care, and some of the limits of existing programs for meeting their family's needs. And the last couple of points they brought up also touch on the intersection of family and health, and that women felt there was a need to improve perceptions of pregnancy and maternity in the CAF, and that some of them felt ostracized for becoming pregnant and were concerned about some of the impacts that this would have on their career progression. Now, of course, that's only one aspect of health. Our work on sex and gender has covered a number of military health and well-being issues, and I'll cover just a couple in the next slides. One area that we've explored from a gender-based lens is alcohol use among CAF members. So we know from past studies that there's been some that have shown greater use of alcohol among military personnel compared to the general Canadian population. And a lot of the times this is attributed to the fact that it's mostly composed of men in younger age groups. So going beyond examining just gender differences and problem alcohol use, this particular analysis explored differences in the correlates of risky drinking using data from the Health and Lifestyle Information Survey. So as we see in the figure here, the prevalence of binge drinking and harmful drinking was indeed higher among men than it was for women. However, the analyses of the correlates pointed to some pretty important considerations regarding how to address alcohol use among women. Specifically, while for both men and women, problem drinking was most likely to occur if they were younger and single, some of the other attributes that were associated with problem drinking varied. With men, these were factors related to the geographic location of their serving base. So for example, whether it was in an urban, peri-urban, or rural area with a higher prevalence among those outside of urban areas. It was also related to their self-rated health, so if they had poorer health, and also to their element, so if they were serving in the C element. By contrast, for women, a big correlate of problem alcohol use was poor mental health, and specifically PTSD and distress. So we know from other research that comorbidity between mental health conditions and alcohol use disorder is related to more complex treatment needs and poorer treatment outcomes. So this analysis really emphasizes the importance of considering the needs of diverse groups when it comes to how to address health issues, because if we don't do this and recognize and address these distinct needs, it can result in some people feeling or being left out on their own in order to address their health needs. So following the war in Afghanistan, there was a great deal of emphasis that was put on understanding factors for poorer post-deployment mental health outcomes. Using data from the 2013 Canadian Forces Mental Health Survey, this particular analysis examined gender differences in the association between combat exposure and other forms of trauma with lifetime PTSD. So in other words, we wanted to know the extent to which personnel with exposure to such trauma were likely to report symptoms of PTSD, and whether that extent was greater or lesser for women compared to men. So what we found is that among personnel who had a deployment history, women had generally greater odds of reporting lifetime PTSD compared to men. However, the extent to which their odds of reporting PTSD increased as a function of their combat exposure didn't differ when we compared that to men. So this actually suggested that there was other factors that were associated with their increased odds of reporting PTSD. Now, where we did see a difference was actually with their exposure to non-combat trauma, and specifically interpersonal trauma. So here what we mean is any type of trauma involving an interaction with another individual, and it included things like being beaten or sexually assaulted. So here what we actually saw was that the extent to which women's odds of reporting PTSD increased as a function of their exposure to interpersonal trauma was actually greater than that of men. And we can actually see that in the figure on the right. It's represented by the steeper curve for women compared to men. So I've presented a couple of examples of research topics where we've taken a sex and gender lens to show how we've really come to appreciate the importance in doing this. Now, I note again that we're only representing a few examples of what we've looked at, because I did want to provide a couple of more detailed examples as opposed to giving more of a comprehensive summary of what we've done. That said, we're still relatively new in our efforts to consider sex and gender in our research, and this leaves us with some important gaps. First, a lot of our work is still mainly focused on looking at male or female sex or gender differences, as opposed to considering the broader range of gender identities. So increasingly, what we've been doing is we've been collecting more detailed information on sex and gender. And I think that's really important because it gives our participants of diverse sex and gender identities with the opportunity to see themselves in our findings. But we're still, in many cases, limited to exploring differences between men and women. And a lot of this is just a function of some of the challenges that we have in balancing some of the concerns that we have with preserving the anonymity of our participants, with recognizing also the importance of giving them a voice. So we really have to consider this going forward on the best way to do this. Another limitation is that we've given less consideration for some of the cultural dimensions of the CAF context that can play into some of these sex and gender differences that we're seeing. And they can play a role either by kind of sustaining them or exacerbating them in different ways. Now, one topic where I see us doing a better job in this context actually involves the research that we've been doing to better understand inappropriate sex and gender-based behaviors. Now, I haven't touched on that topic at all during this presentation, and this is by no means because we don't see it as important. Rather, we just felt we couldn't do the topic any justice by covering only part of it within this presentation, so we really opted to cover other topics that might not have been covered as widely in CIMVHR. So at any rate, one of the things that we've been exploring in relation to inappropriate sex and gender-based behaviors is a research strategy to look at cultural aspects that can play a role in these behaviors. And there's a couple of examples of some dimensions that we're planning on considering in that context listed here. Some of them could be useful to examine a broader range of gender-based issues, some of them less so. But either way, it would be worth exploring some dimensions of culture that we might want to explore to better understand other gender-based issues. So again, we're still relatively new in our efforts to consider sex and gender in our research. We have a lot to learn. In fact, some of the work I've talked about today predates some of our more aggressive efforts to improve our consideration of sex and gender in our research. Since then, we've established a set of guiding principles for collecting sex and gender information, and we're going to be revising that as research and practices evolve. We're also working towards integrating the Sager principles into our research guide, and we're planning to ensure that these are applied when reviewing research submissions through our Social Science Research Review Board. And going forward, we're also optimistic that we're going to be able to focus on more diverse perspectives in our research, as we'll be in a position to look at the intersectionality of gender with other aspects of identity among personnel. So, for example, through our upcoming CAF harassment and discrimination survey, and some of the additional qualitative research that we're planning on conducting on the experiences of LGBTQ2+ members. So with that, I thank you very much for your time and welcome any questions you may have. Thank you.
Thanks so much, Jennifer. That was excellent. Again, we're going to be reflecting your questions posed on YouTube, so please keep those coming. To kick us off, though, I want to dig a bit into some of what you referenced in terms of challenges and gaps. So one was you spoke about cultural dimensions that might be considered and elaborated on in the CAF. Can you give us some examples of that and how you're factoring those into research?
Yeah, so before doing this presentation, I actually spoke with our kind of expert on cultural aspects, Dr. Karen Davis, and she actually kind of gave me some really good information on where we're heading in terms of inappropriate sex and gender-based behavior with regards to cultural dimensions. And one of the ones that she kind of highlighted as being, which I thought was really interesting, is this idea of job gender context. So what that really refers to is kind of like the gendered nature of the workplace that somebody finds themselves in. And in other areas, it's kind of described as the ratio of men to women where you work. And it's been found to be linked with things like a lower representation of women, also kind of an environment where values like assertiveness, aggressiveness, and competition are espoused, and also kind of a preference for men being in power. And this particular concept has been linked to rape myths. So it is kind of considered to be something that is linked to a more permissive culture when it comes to sexual misconduct behaviors. Now, one of the other aspects of it is that it does kind of lead to this propensity to lack tolerance for things like anybody who is divergent from a particular norm, or also who may kind of have a difference of opinions or ideas. So this kind of idea that it's a dimension that can lead to maybe lack of inclusion or feelings of inclusion is something that I think is really interesting to maybe explore if we're looking not just sexual misconduct, but any kind of area where we might have sex and gender-based inequities. So in the context of health, we're seeing a lot of health disparities by sex and gender, in some areas more than others. And a lot of these, to a certain degree, can possibly be linked to policies that create these inequities. And so if we have a culture that kind of espouses these values that are less open to diversity and inclusion, these are the same people who are kind of creating and shaping the policies that are impacting the health and well-being of our people. So I think it's just looking at it from a broader lens and looking at the wider context that really shapes, the factors that can ultimately have an impact down the way in terms of like health and well-being.
Thank you. So a question from YouTube says, CIMVHR is one of several different research groups within the CAF. Do you know if all the CAF and D&D research groups are looking into applying Sager principles?
So I agree. We are definitely not the only ones who are doing research in this area. We have some folks who are very active in the research, for Canadian Forces Health Services Group, for example. I know a lot of the research that they do, because of its health focus, tends to emphasize biological sex. And again, they also do work often with administrative or health databases. In terms of exploring the Sager principles, I can't really comment on that. I don't have enough visibility on where they're at in terms of implementing that. But I know when we do work collaboratively with that group, we tend to try and introduce some of the gender aspects of the research that we've done. And one example of that is actually the alcohol use analysis that I talked about earlier. It was a collaboration between both groups. And obviously from the gender-based lens, you can see that we brought that into the research that we did.
Awesome, thank you. So back to challenges, just to keep going on that front. You know, you talked about one of the challenge in research being that research is still largely focused on gender binary, so women and men. And this is an issue that arises a lot in my work, and of course my own appreciation and understanding of the issue has evolved over time. And I now understand better why gender binaries are problematic. And I am also, you know, much like you, still in many instances trying to convince people that we even need to study gender disaggregated data or think about different lived experiences, et cetera. And sometimes when you start talking about non-binaries, you can almost see people just switching off. They don't get it. They don't want to get it often. And then the whole issue sometimes gets lost. So how do you talk about the issue of gender binaries and the importance of perhaps moving beyond them to people who've never considered it before? And how do you manage that? And when they say, what does that actually mean? How do you explain what's important about it?
So I think that a lot, you know, we're still learning, and we're still even at the stages of really kind of highlighting how it's important to take a look at women's perspectives in the military context. And from that, I think we're really starting to learn that there's some important factors that we need to take into consideration in terms of like inequities of how they are impacted by certain policies and programs. So the first thing is to really highlight the fact that, you know, not everybody is impacted equally by the same thing. And having that dialogue is important. A lot of people may have a bit of resistance just because of the fact that we're, you know, if we look at the numbers, I think our most recent survey that we did where we were looking at more than just male or female gender was 1%, you know, for the other groups. And that doesn't seem like a really high number, but if you think of 1% over an entire force of 70,000, we're talking about 700 people. And so it becomes a question.
These are people who identify as non-binary, is this correct?
Exactly. And so it just, when you think about it in terms of what that means in a number, it's a little bit easier to appreciate how not having that perspective of 700 people is, you know, it's a bit of a problem, and it's very exclusionary to not allow people to have the opportunity to have their voice heard. So, you know, one of the things that I think is really important, we're not always able to really drill deep when it comes to doing disaggregated analyses. A lot of that has to just do with, you know, statistical significance, statistical issues, or even just the risk of identifiability. But the question is important because people are able to identify themselves the way they see themselves, and they then know that they're represented in the data and that their voice was heard. It's a symbolic thing, and I'm hoping that we will be able to find a way to kind of go a little bit further than that. It's obviously not sufficient, but you know, I think it's a good first step.
Great, thank you. And so quick follow-up that came online, and you may or may not know the answer, but do you have a sense of how the representation of non-binary gender personnel in DCAF differs compared to the general population?
I do not. Okay. Yeah, I can't really speak to that.
No, that's okay. Well, if anyone has the answer, we can post it on the YouTube comments, just checking in case you did. We've got a couple of questions related to French and francophones. And so I'm going to translate them to ask you in English, and then I'll also read them in French. So we had a question about how much of the material, especially when you're teaching a course on gender in the military, the research was done in English and published in English. So does the DRDC, for example, have they done research in francophone contexts? And could this be included in anglophone research? And does the DRDC translate these? Are there research findings and materials that could be resources that basically that could be used by French-speaking instructors? And it said that many of the francophone researchers are particularly European. So I'm just going to read it in French to not be a jerk about this. Le problème présentement, surtout quand tu enseignes un cours sur le genre et le militaire, c'est que les recherches ont été faites en anglais et publiées en anglais. Est-ce que des RDC, par exemple, ont fait des recherches dans les milieux francophones? Ils ont peut-être été inclus dans les recherches anglophones. Est-ce que le DRDC a traduit ces recherches? Les recherches francophones sont surtout européennes.
C'est une très bonne question. Habituellement, ce qu'on fait pour avoir la voix des francophones dans notre recherche, c'est pas nécessairement explicite pour juste les francophones, mais on va avoir des documents qui sont traduits dans les deux langues et on va laisser nos participants répondre dans la question de dans le langage de leur choix. Donc, souvent, ce qu'on fait, c'est qu'on va peut-être regarder les différences par langue, mais on ne va pas nécessairement faire des analyses qui sont séparées. Alors, c'est peut-être une question intéressante pour le futur de regarder s'il y a des différences dans chacun des groupes d'une façon un peu plus détaillée, parce que c'est sûr qu'encore, il y a des facteurs culturels qui vont peut-être influencer les résultats. Mais en ce qui concerne la recherche sur les francophones spécifiquement, notre recherche souvent est vraiment déterminée par nos clients. Alors, les questions que les forces armées canadiennes ont vis-à-vis les grandes questions, qu'est-ce qui arrive dans la politique en ce moment. Ça fait que souvent, nos recherches sont un peu plus larges que simplement dans les communautés francophones, mais c'est pas nécessairement toujours le cas. En ce moment, j'ai un peu de trouble à penser à quelque chose qu'on a fait récemment dans la communauté francophone, mais on a des RDC, je sais qu'ils ont un centre à Valcartier, alors c'est sûr que probablement dans ce contexte-là, il y aurait plus de recherche dans ce domaine-là. Alors, je m'excuse, je ne parle pas souvent en français, alors si j'ai mal répondu, je suis désolée.
Merci pour la question, and thank you. So we're going to move on. Jennifer, we'll see you again in just a few minutes for our panel, and we'll come back to some of the other questions that are being posed online. So thank you for responding to those, and thanks for everyone who's sending them in. So we're going to turn now to Dr. Margaret McKinnon speaking about sex and gender-based research among Canadian veterans. Margaret.
Good morning. My name is Margaret McKinnon. I'm the Homewood Chair in Mental Health and Trauma at McMaster University in Canada. I'm also a clinical psychologist, and in addition to representing McMaster University, I'm also here representing St. Joseph's Healthcare Hamilton, along with the Homewood Research Institute. And I'd really like to begin by thanking Veterans Affairs Canada, along with CIMVHR, for inviting me to participate in this groundbreaking event that's happening this morning. So I'm really honored to be here today talking about sex and gender-based research among Canadian veterans and taking a very critical intersectional perspective to this work. And in the talk today, we're going to focus on all domains of veteran well-being. And really, as a clinician, this is something that I think is very important when we think about individuals' mental and physical well-being, to recognize that that extends well beyond simple biological health to all aspects of being, including having a sense of purpose and being engaged in activities that are meaningful, being integrated within the social world and with family and friends, having access to clean water and to a safe, adequate, and affordable housing environment, and really being supported and understood by all Canadians and valued by all Canadians. As a clinician, I know many of us often think about our own goals for patients, but we need to really think about, for everyone that we work with, be that as a clinician, as a healthcare provider, as someone in service to military members and veterans, to really recognize that well-being is important across multiple domains. And in particular, we need to recognize what's important to that veteran themselves in terms of their well-being. So I'm going to talk about a number of different domains of veteran well-being and how they relate to sex and gender-based analysis and how these analyses are critical in understanding those key domains of veteran well-being. We know that looking at purpose and financial stability, among all Canadians, income is linked to health and life satisfaction. And the majority of regular force veterans do report being satisfied with their finances. However, approximately 1 in 5 do report experiencing income instability or low income during that first year following release. But this is expected to recover by approximately 8 years post-release. But importantly, when Jim Thompson and his colleagues at Veterans Affairs Canada looked at how sex and gender may impact upon purpose and finance following release, we see that in fact, following discharge, medically released members and females appear to experience the largest reductions in their income. Without performing that sex disaggregated analysis, we would not know that women experience more vulnerability during this period, which points, of course, towards the needs for specialized and targeted interventions or supports for female veterans during this critical period of transition. We can also look at veteran well-being from the perspective of health and social integration. And we know, of course, that mental health is absolutely critical to the ability to function within families, within the workplace, and other critical social arenas which are so important to all of us as Canadians and to veterans. Looking at Canadian serving members as well as veterans, again, sex disaggregated analyses have been performed looking at rates of mental health conditions. And so here we find, by disaggregating these results, we find that approximately 1 in 2 female veterans will report having experienced at least one anxiety disorder, in this case over the past 16 years. And this contrasts with the rates of approximately 2 in 5 males who report experiencing an anxiety disorder over the same period. When we look at rates of depression among female veterans, we see that at one point in time over the past 16 years, about 1 in 2 female veterans report having experienced depression, contrasting with approximately 1 in 3 males. And again, this tells us about the health and well-being of our veterans, and also where, again, we might want to pay particular attention among males and females and the likelihood of developing particular mental health concerns. We can look at this further. This is the most recent Life After Service survey conducted by Veterans Affairs Canada. And disaggregating the 2019 findings, we find that while overall male and female veterans are more likely to experience a mood disorder, an anxiety disorder, or PTSD relative to the general population, in fact, rates of mood disorders and anxiety disorders among veterans are higher in female veterans than in male veterans, whereas rates of PTSD are just slightly higher among male veterans. So if we're thinking about stratifying risk, for example, we might think as a result of performing these disaggregated analyses that we can see that females may be at more risk, or in fact are at more risk for mood disorders or anxiety disorders, where males may be at slightly greater risk for PTSD. That points to where some of the preventative efforts that need to be taken, as well as our intervention strategies as well, and where those might be targeted. Looking further at other aspects of health, we really did have some key findings emerge from the Veterans Women's Forum that was held in Charlottetown last year. And this was the first Women Veterans Forum held in Canada. And here, looking at the summary report that emerged from this forum, what we found is that this meeting identified some unique issues that may impact women veterans that will have less impact or do not have impact on male veterans. And this includes, for example, that participants at the forum identified that infertility issues both during service and after service may be particularly relevant to female veterans. And this can include, for example, experiencing the possibility that women serving in the military experience greater rates of infertility than those that don't. And this warrants certainly greater investigation. Similarly, participants pointed towards stress incontinence among female veterans and serving members that may be less or reduced among male members, but again requires further investigation. We know as well that serving members of the Canadian military, along with female veterans, experience menopause that is not experienced by men. And there are, of course, unique health issues associated with menopause, including, for example, changes in bone density that would not be experienced in the same way by male members. We can also think about additional issues such as musculoskeletal issues as a result of service and how those may differ across the male and female body. And even looking at prescribing practices, medication metabolism, for example, may differ with pharmacological treatment across males and females. And that's something very important that can guide us in terms of better serving our veterans within the health domain of veteran well-being. Looking further again at how sex disaggregated findings can inform the health domain of veteran well-being, we again see higher rates of chronic pain and arthritis among veterans compared to the general population, with chronic pain being slightly elevated among female veterans. Where we do see a significant discrepancy is in rates of migraines between male and female veterans, where females appear to be experiencing a higher percentage of female veterans experience migraines. But again, here, we need to think about complexity around this issue. So are, for example, women experiencing menopause during the period where we see that elevation in migraines, where increases and decreases in hormones may increase risk for migraines during this period. So whenever we look at these findings, we need to approach them from a complex lens, thinking about the multiple factors that may contribute towards these findings. Oftentimes, when we think about sex and gender-based research, we often consider females and female-identifying individuals more so than we might consider males, male-identifying, and non-binary individuals. And that, of course, is a mistake. We really do need to pay great attention in these analyses to findings not only for females and female-identifying individuals, but of course for males, male-identifying individuals, and non-binary veterans as well. Looking at the issue of sexual misconduct in the military, we see that, for example, between 2016 and 2018, we did see a decrease in the regular forces in terms of reporting being personally targeted by sexualized or discriminatory behavior. But we do know that approximately 1 in 4 women and approximately 1 in 5 men continue to report being personally targeted by sexualized or discriminatory behavior within the military workplace. And oftentimes when sexual misconduct within the military is discussed, it's often discussed within the context of its impact on female and female-identifying individuals. But if we look at the overall number of males enrolled within the military, or those who have veteran status, there is a larger number of males overall who serve or who are veterans in Canada. And thus we see the disproportionate effect of sexual misconduct within the military and those overall numbers of individuals affected being high among males as well, are similar to those reported among females. And so when we think about clinical practice, of course, we do need to think about how this focus upon males is so critical. So for example, when a male comes for an assessment, a mental health assessment, this is really a clinical pearl gleaned by Ruth Lanius, who's a psychiatrist at the Operational Stress Injury Clinic in Parkwood. And what she's learned is that to ask males as well whether they've experienced sexual misconduct within the military. And what we see here is that by normalizing this experience and saying, for example, I've heard other men who I've spoken to have experienced some difficulty with sexual misconduct during their service. I'm just wondering if that happened to you as well. And I think with greater investigation, we will certainly have a better sense of the numbers overall of males and females, but recognizing that males are also likely to be impacted by sexual misconduct in the military workplace. I want to turn our attention now to intersectionality, and this really is the recognition that not all people or not all groups are the same as one another. For example, this could extend to transgender individuals, to Indigenous and Inuit communities, as well as individuals living in the North and living in the South. Recognizing all these unique identities that exist within Canada, the Government of Canada has been very clear in noting that our experiences are affected by the intersecting parts of those identities and the context where we are in and what our lived realities are. And all of us have multiple identity factors that intersect together to make us who we are. And this is really clearly illustrated in the figure on the left, which was prepared by the Canadian Institutes of Health Research to assist researchers throughout Canada in looking at intersectional aspects of identity, we see sex and gender as being central to that wheel, but we need to also recognize how sex and gender intersect with race, ethnicity, religion, age, disability, geography, culture, income, sexual orientation, and educational attainment. And all those features on the wheel interact with one another to really situate an individual in place in terms of self-identity, and also in terms of the multiple and interactive effects of all those different identities that people experience. An example of that is when we look at the likelihood of experiencing sexual assault within the regular forces, looking at females alone would tell us that this is reported by 1 in 4 females. However, not sexual assault, but rather sexual misconduct. When we look at the likelihood to experience sexual assault, we see that sadly, this is highest among young minority women. So looking at, again, intersecting parts of identity, of being of age, of minority status, and of being female as opposed to male. Going forward in this work, we will certainly need to look at the impact upon, for example, the LGBTQ2S+ community, where very little is known about sexual misconduct in the military, as well as all these other interacting aspects of identity, including disability. I want to highlight an example of how intersectionality would apply to the current situation surrounding the COVID-19 pandemic. If we look at the headlines, we certainly see, for example, that COVID-19 has had a disproportionate impact on females and on women. So what we see here, for example, in Canada, is that women's participation in the labor force has actually reached its lowest level in 3 decades. And this has been attributed to COVID-19 and its disproportionate impact on women who, for example, often assume childbearing or child-raising responsibilities. We see as well that men are more likely than females to experience death as a result of contracting COVID-19, where, for example, in New York City, in fact, 2 times more men died than women who contracted the virus. But in looking at how COVID-19 impacts upon males and females, we also need to consider intersectional aspects of identity. And what I have here displayed on the right is an infographic, a very helpful infographic put together by the PTSD Center of Excellence as part of the Guide to Moral Injury among healthcare workers. And what we see here is that among racialized individuals in Canada, there is a much higher risk of exposure to COVID-19. And this intersects with those intersectional aspects of identity. So for example, individuals belonging to racialized groups are more likely to experience income inequity and poverty, are more likely to live in high density neighborhoods, and are more likely, for example, to live in congregate settings or to use public transportation. And of course, this intersects with sex and gender in terms of the overall impact. So if, for example, we were to look at labor force participation among women, among racialized and marginalized communities, we would expect to see a different effect than among women who did not belong to those groups. And that really, again, points towards the importance of conducting sex and gender analyses within the context of intersectional identity. I think the good news is that a lot of work across Canada is beginning to explore these topics, and often in really key partnerships between members of the Canadian Armed Forces, Defence Research and Development Canada, Veterans Affairs Canada, the public service, individuals working at our OSIS and OSI clinics, as well as academics, clinicians, and researchers across Canada. I just wanted to highlight a few of these examples this morning. So for example, Maya Eichler at Mount St. Vincent University has done some really critical work examining military gender integration, as well as military sexual trauma. Brenda Fuster is a PhD candidate who's done some really critical work examining female veteran homelessness. I want to also really highlight the work of Stacey Silens, who's a scientist at DRDC. And Stacey conducted 67 victim survivor interviews among active duty and retired Canadian Armed Forces members who had experienced sexual misconduct. And the work that she did has informed Operation Honor and other critical initiatives occurring within VAC and CAF. We can also see this work at Queen's University, for example, where Alan English is exploring culture change within the Canadian military and organizational strategies that may assist with that cultural change. There's also a longitudinal study of LGBTQ2+ members, Canadian Armed Forces members and veterans that will inform for many years much needed work and interventions and supports for this community, our communities. I want to highlight an example of where we see various sectors of the Canadian workforce, of academia, and of the Canadian Armed Forces, DRDC, and Veterans Affairs Canada coming together. And this has been is one example, through a unique community of practice supported by the PTSD Center of Excellence in Ottawa that explores sexual misconduct or military sexual trauma within the Canadian Armed Forces and its impact on veterans. And here, this work was funded initially by a targeted engagement grant, by a Mobilizing Insight and Defense and Security Program grant. It now receives funding from CIMVHR and True Patriot Love, as well as from the PTSD Center of Excellence. And this group initially came together around the potential relation between sexual misconduct in the military and the potential for moral injury. And this work originally found its genesis in a collaboration between Alex Hebert, the chief of psychiatry at VAC, Rosemary Park, a veteran who leads Service Women's Salute, Ruth Lanius at Western, and Andrea Brown and myself at McMaster University. And here, as we began this work, we realized that we alone did not have all the answers, we didn't have all the information, and we had a lot of work to do with outreach towards those with individuals with lived experience in this area, along with other members of VAC, CAF, and other segments of the Canadian communities. And so here we have come together as a weekly community of practice, and we gather together key stakeholders across various sectors. These include Christine Hutchins, who's the Senior Director of the Office of Women and LGBTQ2S Veterans at VAC, Ruth Stanley Akins, who is a truly exceptional clinician, who has led in part the Sexual Misconduct Response Center, Chantal Ruel, Manager and Senior Policy Advisor at the SMRC, Stacey Sillins with the unique knowledge that she brings from DRDC, Patrick Smith, the CEO of the PTSD Center of Excellence and Center of Excellence staff, Alex Hebert, Rosemary Park, and then a host of clinician scientists from across the country, including those from Western University and Parkwood OSI, the University of Alberta, and from McMaster and the Homewood Research Institute. And working together, we have learned many important lessons. And one of the first was that while we have a developing body of knowledge around the experience of female and female identifying military members and veterans, certainly relatively less is known about the experiences of male identifying individuals and non-binary individuals, as well as members of the LGBTQ2S community, individuals living in rural and remote areas, and really, again, those facets of intersectional identity, which are often not the focus of research work that's currently being conducted. We also heard very clearly from individuals with lived experience that many women feel they have already told their stories and that we need to look at unique ways of examining these stories rather than just asking the same questions again. This group is also very important, we find, for knowledge exchange and knowledge transfer, where everyone comes together each week with a unique piece of knowledge or information, which we can contribute to the group and which we can discuss together and generate solutions along with research ideas. And really, how do we move the needle forward on this critical issue, and in particular with respect to intersectional identity, which really does remain to be explored. So I want to conclude by saying that while we've gone a long way, we have a long way to go, and a very long way to go. We need to pay careful attention to intersectional identity. And here I've listed individual identities, but again, we need to consider within the lens of sex and gender analysis, how these identities interact. So this includes identifying as a member of the indigenous and Inuit communities, the LGBTQ2S+ communities, Black and South Asian communities, individuals living in northern, rural, and remote communities, individuals who belong to or identify with marginalized and racialized groups, individuals with disabilities, better known as abilities, and how these identities interact with one another, with sex and gender, but also how these unique facets of ourself and our identity intersect with one another to create who we are and create who we are within the social community and in Canada. So overall, I would conclude by saying that our work must be guided by GBA plus analysis and also by intersectionality. And I want to conclude with what I think is an incredibly instructive message from Rear Admiral Patterson at the recent VAC, Women's Veterans and LGBTQ2S Virtual Forum. And here Admiral Patterson reminded us that GBA Plus is a very important tool that allows us to carry on the business of defense. So thank you very much for your attention today, and I look forward to the panel discussion.
Thank you, Margaret. A question from YouTube for you, Margaret. Would you consider military rank as one of the spokes on the intersectionality wheel?
Most certainly. And I saw that question come in during the talk, and I want to thank the individual who posed that, because most certainly that's an important aspect, in particular of military and veteran identity. It would be similar in other sectors as well. So for example, within the first responder community, where an individual's experience does differ significantly based upon their rank within an organization. And again, recalling how that intersects with other facets of identity as well, including sex and gender, but certainly not limited to that facet of identity.
Thank you. In your presentation, you talked about gender dimensions of COVID-19 and how there's been some attention to them in the media. I have a great hope that the pandemic can help underline the importance of GBA plus and gender disaggregated data. Do you see attention to it related to the pandemic actually translating into other areas of research and policy analysis? And similarly, do you think the Black Lives Matter movement is influencing data collection and analysis, particularly as it relates to intersectional factors?
Thanks so much for that question. So I most certainly do. I think that I think this current period in history has really shaken us from complacency. And it's just really bearing in mind something that someone who I work with at McMaster said. It's sad that it took the life of George Floyd and Breonna Taylor, and also recognizing the experiences of individuals in Canada, including Indigenous women who have been murdered and disappeared, along with the anti-Black racism, which has existed for centuries within Canada. And I think what these historic movements have done is really reminded us that we need to consider moment by moment and in everything that we do, the impact of racism, the impact of intersectional identity, and really to move forward with this and not fall when this historic period ends. It reminds us as well that, again, highlighting that we need to consider all facets of an individual's identity, be that LGBTQ plus, a member of the Black or South Asian community, looking at disability, looking at whether or not one belongs to or identifies with the Indigenous or Inuit communities. And really being able to look at these experiences, but within the lens of lived experience, because we can't come from a high and say this is the work that we'd like to do. We have to do it in partnership with others and members of the community. And as Maya said in her talk, this needs to be baked in from the very beginning. So rather than posing questions without asking for input, we really need to take that first person perspective and really remember the lessons that we've learned from our Indigenous and Inuit partners, who not only are involved in asking the questions, but remain throughout the research, are heavily involved throughout the research process. CIHR now requires that. And then thinking about how when we conduct research, we can't just drop in and do research. When we're going to do something like this, we want to be a part and in partnership with the community, to remain in place, and also to bring the lessons learned back to the community, because it's very important not to just come, collect or take data and information, but rather to help the community in their use of that information and remain a partner.
Thank you. Yeah, I hear a lot these days about lessons learned, and I've learned myself to talk about lessons observed, because I think we haven't always learned them or fed them back into our systems, but hopefully we're doing so in some of those ways. Another question relates to another part of your presentation on male military members. So in practice and research, it's common, obviously, to focus on incidents of sexual misconduct affecting female military members and veterans, but of course, expanding our understanding of treatment options available and women who have experienced sexual and military trauma is essential, it's critical. What are the other stories that need to be told on this front, and how do we work across research and clinical settings and disciplines to address the unmet needs of Canadian military members and veterans?
Thank you so much again for that question. As I'd mentioned, we've come together across Canada in a community of practice. And I think by having membership that spans multiple disciplines, multiple parts of the country, and brings a perspective from policy, clinical treatment, government stakeholders like Christine Hutchins, the clear involvement of Veterans Affairs Canada and their support, it allows us to recognize the many different stories that exist within the sexual misconduct. It's very clear, for example, we know very little about the experiences of transgendered members within the military and who are veterans and their experiences of sexual misconduct. And, I recall being at the Women's Forum in Charlottetown, which was an amazing start to the work that we need to do. But I think if we move last year, exactly, in 2019 in Charlottetown. But I think that forum was, so instructive in recognizing those who have not been recognized as well. And I know how difficult it can be to listen to talks like these and not to see your own identity represented. So I think what we need to do is move together in those interdisciplinary, multi-sector partnerships, because Canada's a large country, but we're small. We know one another. The capacity to interact online now in a very different way is a way that we can leverage that strength as well, so that we can reach out, for example, to women, men, non-binary individuals living in our northern or rural and remote communities to ensure that their voices are heard. And as well as bring together people across the country, bring lessons learned in Canada, because I think that SMRC and its leadership, like Ruth Stanley Aikens, and Chantal Ruel and Christine Hutchins, we have important information that we've learned in Canada. We have been leaders in many ways. And how can we bring that information to other sectors, like our first responder community, where these issues are also of great concern, as well as in partnership with the other Five Eyes countries and other parts of the world, to have lessons learned between us and shared. That's what I would say, I think, in response to that question.
Thank you. So I'm going to ask the other panelists to turn on their cameras, please, and join us for our final group discussion. We'll take some more of your questions online. Stephanie Bélanger is answering many questions directly on YouTube if there's a direct or quick answer. And of course, we'll incorporate as many as we can here. And now our panelists, as Margaret mentioned, have been reading them as they're coming in and are going to speak to them as well. So Jennifer, we just need your video on. Perfect, thank you. First of all, thanks to all of you for sharing your presentations. And as Stephanie has responded online, they will be available soon. Both the PowerPoints will be available shortly, and the recording of this entire session will be available online as well, in case anyone else is wondering. So I want to start, Maya, you shared a number of tools, and thank you for that. It's always essential to get practical on these and give people resources. In addition to becoming familiar with those ones, what else can researchers watching now do to better integrate sex and gender in their work? Maya, maybe we can start with you.
Sure, yeah, I think there's a couple additional things that researchers can do. I think one of the first steps is to be curious about the sex and gender research that is out there and familiarize oneself with it. That's a really good first step. When you are studying a particular issue, whether it's homelessness, veteran homelessness, or veteran unemployment issues or medical issues, to really kind of not think of the sex and gender research as this other kind of silo, but really to draw on the knowledge that's already out there. And to integrate it into your own work when you're doing a literature review, for example, to really acknowledge the sex and gender research that's out there. I think the second thing that people can do is and we all need to do this, is to be really self-reflexive about our own implicit assumptions and biases. We all have that. This is sort of an ongoing learning experience that we need to reflect on. And I mentioned some. in my presentation already. When we think of when we talk about veterans, do we really mean all veterans, or do we mean male veterans? When we think about spouses, are we including male civilian spouses, or do we really mean female military spouses who are civilians? And I myself have encountered my own biases. Like when I started doing some of this research, I think about 6 years ago or so, I was focusing on Afghan war veterans and their experiences. And after talking to a lot of veterans and doing interviews, I realized that, well, I'm actually excluding a lot of people here, and I need to kind of broaden the categories, because what I was doing is, in a sense, I was privileging combat and deployment related experiences. And I think also thinking about, what are we focusing on? What do we think is a really important veteran issue, and maybe expanding our scope a little bit to include things that traditionally have not been considered part and parcel of military and veteran research, right? Whether it's caregiving, parenting, interpersonal violence, all of these issues need to be part of what we look at. And just finally, I'll say, I think meaningfully consult with the people we study. Margaret mentioned that already, and I really appreciated what she had to say about that. But I think it has to be done very carefully and very ethically, and it has to be done in a way that people's voices are really empowered and not exploited.
Yeah.
Thank you. Jennifer, do you want to chime in with some more?
I think those were all really excellent points. I was just going to say, a key piece is just really thinking about, when we're developing our research, what our research questions are. If we have any hypotheses going forward, to really ask the question of, do we think this applies to everyone equally? And when we find ourselves questioning whether that's the case, it's like really kind of going and drilling a little bit more into kind of looking at those GBA plus elements. I think one of the things that we've started doing is, at least asking the questions. I've mentioned that a few times, but asking more, more than just biological sex, more than just binary aspects of gender. That's really important. And we are trying to kind of, I think the concept of mainstreaming that you brought up earlier, we're trying to make it sort of more of a practice in the kind of research that we're doing right now. And that's really important, but it is not something that should be done, when you've kind of got the research protocol ready to go and you're like just, reviewing it and making sure that it's all good. I think that if we have this approach where we are really thinking about our research questions early on and how we can sort of approach them from different perspectives, it's going to all kind of make it so that we will start asking these questions. We'll build them into our research programs in a bit more of a, I guess, like a comprehensive way. One thing that we have started doing as well, most recently, is trying to engage our defense advisory groups in the development of our research questions. We're really kind of just starting to engage them in a more meaningful way, and we're really happy with how that's going so far. And so I think that's something that we really like to proceed with going forward, and really kind of make it almost like an integral part of how we build our research protocols going forward. So it's about thinking things critically and taking other people's perspectives into consideration in the way that we do our research. It's for us, it might not always be automatic, but I think the more that we do it, the more that it'll become automatic, and it'll just become, instituted in our practices.
Hopefully. Sorry. So, the points that you all spoke about seem so clear in so many ways, and yet I know that it's challenging to get budgetary resources to make the time, often to make the case about this work being needed. What are some of the budget or a whole spectrum of other barriers or challenges that you each face when trying to better integrate sex and gender in your work? And do you have any strategies or tips for overcoming them? Margaret, do you want to start with this one?
Sure, I'd love to. Thanks so much. Yeah, I think the one thing that we really have learned is that these things take time, and that we also need to recognize that we can be wrong. So in the work that we've done surrounding sexual misconduct, we've spent a lot of our time consulting out to stakeholder groups. We value, for example, the input, tremendous input we've received from Reclo Gagnon and from It's Just 700 as an example.
And it isn't the case. I think when we started doing some of this work, we assumed that we would sit down as researchers, clinicians, policymakers, and generate a question set. And that question set came from us, and that was the wrong approach. We needed, it is that, acknowledging that you're wrong and being able to say, we need to go out and trial this, receive feedback from the very beginning, and things sometimes that we think will take, 6 months might take 2 years. And so it's having funders really understand that while a grant proposal might be put in one way, we do need to continuously adjust for the situations on the ground, and for taking the time, I think, to really carefully consider the input that we've received and make continuous adjustments that allows the voice of lived experience to be heard. I really can't emphasize enough how much that's been our lesson, is that we need to be prepared to change and prepared to say, no, this is wrong. And Ruth Annis will always say, once we do a lot of PTSD work together, and she once asked one of her patients about, we had divined all these extensive batteries, and she said, what did you think of that? And she said, Ruth, you didn't ask me a single question that was relevant to me. Right? And so, yeah, but that's okay to hear, right? It's good for us to hear that, because we have concepts and constructs that we consider valuable from a clinical or a research perspective, even a policy perspective, that may not be relevant to the lives of the individuals who we're trying to serve. I really do admire Veterans Affairs Canada's domains of well-being approach, where multiple facets of a person's identity are acknowledged, be that economic insecurity, ethnic or racial identity, health status. I think we need to do that. As a clinician, I know we often treat based on, for example, let's get people back to work, where that individual's goal, maybe I'd like to volunteer. And that strikes me. I'd like to call my son, who I haven't called in 10 years. So recognizing individuals' goals and their needs as opposed to just our needs.
Thank you.
Okay.
Maya or Jennifer, do you want to jump in on this one?
Sure, I'll jump in next. So what are some of the challenges and barriers that we face in integrating sex and gender? I think it's good to be really explicit about the fact that what we're confronting has a long history, right? And there's a legacy of male bias institutionally, but also reflected in research. And sometimes, the approach that has been taken is sort of this gender neutral approach that tries to sort of obscure the bias. But I think we do need a really proactive approach. And I saw that one of the questions that came in was kind of about gender and power. And so, we are confronting structures of power here. And I think, researchers are not always comfortable with that, but it is important to acknowledge that this is sort of a bit of an uphill battle, I think. And there is a long history of bias to overcome. So that would be kind of my first point here, that I think we need to really tackle it head on. And that this effort needs to be individual, but also collective and institutional. And that's why I think it's important that VAC and CAF, are starting to integrate SAGA principles. I was really happy to hear what Jennifer had to say about that as well. And to recognize that it's an ongoing effort, that we're all sort of in this process together. We're all learning, even people who are maybe considered sex and gender experts still have a lot to learn. And so this is not something that's going to be solved with one CIMVHR forum or one symposium and one panel discussion, but this is really just the beginning of a long journey, I think. And then the third point I'll just mention is that one of the challenges is really the lack of sex and gender disaggregated data. I mean, we have more now than we had 5 years ago, but that's still a real problem. And while I can't speak to kind of this question of budget issues within CAF and VAC and what's been allocated for sex and gender research, I would say that all publicly funded research really should aim to not reproduce inequities. And so, I mean, I think that's something important to keep in mind. And it also links to this other point I made previously about having good evidence to make good policy.
Can you just say a word about what you mean by not reproducing the inequities?
Well, I think that, who remains invisible in research? Like, let's just take the example I gave before, like with the focus on combat. Let's say we study veterans and we decide, well, combat injuries are the most important thing to keep in mind. So already we have, women underrepresented in that group, if we're just looking at combat veterans. But then we're also, that's kind of being, so we're underrepresenting women, and we're not looking at the kind of injuries that are relevant to them. And so what often happens is that people are already facing more vulnerabilities in their lived experience, and then research sort of amplifies that by not speaking to their vulnerabilities. So the invisibility or the invisibilization, I guess, which is a big word to use here, is sometimes reproduced, through policy and then in research again, and that feeds back into policy. So it's kind of this vicious circle that really needs to be disrupted.
Thank you. Jennifer, do you want to speak to this one?
So at this point, I can speak to where our focus has been. We've been collecting a lot of data for a number of years now, and we haven't always done justice to disaggregated analyses. So as a first step, our energies are really focused on kind of digging a little bit into that, understanding that it wasn't necessarily always designed with the intent of examining sex and gender disparities or anything like that, but that we might still glean a lot of really valuable information that we might have missed in the past. So one of the challenges is kind of using some of this information that we've already collected, which wasn't necessarily intended for that purpose, and trying to make some sense of it. And then that will, help us go forward. We certainly have been putting more attention towards, for example, the representation of women in the CAF. We've been doing some qualitative research to kind of get a better feel for their experiences. And that's really been helpful for us to get some research directions for different areas we might want to explore a little bit more. We are hoping to be exploring the issue of the health of women. Further, I know that was one of the questions, and I can't really speak to the specifics of budget, but I know that our research program is aimed at incorporating more elements of that going forward. I believe that also is the case for Canadian Forces Health Services Group. And so we are, taking measures to kind of get more information in that regard.
So thanks. You were responding to the question, is research being conducted on Canadian Armed Forces female members, identifying gaps in health services that need to be addressed? And if not, in your opinion, does this require more attention? Is there anything else you wanted to add on that?
So we're still in the development stages of this research program, but certainly the aim would be specifically to examine at any kind of policy gaps, program gaps, and that kind of stuff. We have some insights based on our previous research, but it hasn't really dug deep. So we do want to explore that.
Got it. Anyone else want to respond to that question? Okay. So I'm going to share a couple of other questions that are asked, and if anyone can answer, please do so, but obviously don't if you don't have an answer. So what is the strategic plan for collaboration between Canadian Armed Forces and Veterans Affairs Canada to share research findings and other info that could inform planning and priority setting for both organizations with respect to sex and gender issues?
So I know that within the sort of joint CAF-VAC transition research group, we do have the seamless transition task force that recently we've implemented kind of a research integration team. So we have some researchers within the CAF that work in at least the transition space, working very closely with some researchers in VAC in that area. And definitely GBA Plus is something that has been kind of really important in a lot of the work that we've been doing there. So we, CAF Transition Group was stood up, I think going on 2 years soon. And so we're really kind of, there's a lot of, I guess, interest in exploring the policies and how they're impacting men and women veterans. And so for that reason, some of the research that we're going to be exploring there is going to be kind of more taking that angle. And that provides the mechanism for us to be able to more share the research a little bit more readily across the departments, making sure there's not too much overlap and making sure that everything kind of gels and complements it well. So
and informs policy, right? That's the ultimate outcome, of course, right?
And I can speak only from the civilian partnership lens, but I could say that, from the very outset, the work that we've done with VAC has immediately sought to include CAF representation. So really strengthening those partnerships that exist across organizations and also bringing in civilians as well. And I actually find those partnerships so special and have such potential to move forward because, again, we all bring different lenses to the table. And instead of coming from outside and saying everything is wrong, which is sometimes a tendency that academics have, I think instead it's working together towards solutions.
Does anyone want to say any more? We just spoke about the how gender and intersectional factors, including rank, need to be considered together. And the person noted rank also goes with power. What does the research tell us about gender and power? Does anyone want to speak to that? The big one.
I'll just say that, I come from a feminist research perspective, of course, and so we're quite interested in how power is expressed through gender, right? So I think what's important to keep in mind is that gender is not just an individual identity factor. It is a structural factor. It profoundly shapes institutional cultures, like the military's culture. It shapes societies, and there's obviously gender inequalities in society. And so I am worried sometimes with the way that GBA Plus is implemented, because it sometimes tends to be this focus on kind of individual identities, individual identity factors, and there's a bit of a neglect of the kind of structural factors around sexism, misogyny, racism, homophobia, and all of that. I was struck by this recently when I was doing some work for the CAF transition group, because we were looking at the health and other kind of risk factors and vulnerabilities of traditionally marginalized military members who were about to release. And a lot of these risk factors and vulnerabilities are experienced at the individual level, but they really have structural roots often, right? There's often policies of discrimination, like the purge. There's policies of gender discrimination, LGBTQ discrimination that have caused these individual vulnerabilities and risks. So I think it's a really important point to keep in mind that, yes, we're often talking about individuals, but they are embedded in these broader structures of power.
Very well said.
And I think as well, we can never underestimate the pain associated with not hearing your name, right? So the pain associated with your identity not being acknowledged and your lived experience not being heard. And I think it really is incumbent upon all of us to think about who, not just those in the mainstream or those with power, whose voices need to be heard, but also the voices of the marginalized and disenfranchised. And I think really as a mental health clinician, I really do have to say, as you say yourself, Maya, that I think, we need to really pay close consideration to the impact of that and how we change any potential for those voices not to be heard.
Thank you. So where do we go from here? What are next steps to advance this with the group watching online right now and the much broader community? What do you think are some of the best ways forward from here? Who's got a burning answer?
I think strengthening partnerships. Oh, sorry, go ahead.
Margaret, no, go ahead.
No, thanks. I see the way forward as partnerships. I see it as reaching out across Canada, bringing in individuals from multiple sectors, from multiple communities, and recognizing within a single community, there are communities themselves that exist within that individual community. And really, I think it's strengthened together, leveraging our partnerships across the country, our different disciplines, our different institutions, and our different stakeholders from a lived experience perspective. CIMVHR has been doing that recently, for example, around PTSD. It's really bringing together people across sectors and individuals with lived experience. Sam Weiss has led that as the director of the Institute for Mental Health and Neurosciences at CIMVHR, and I think we could take that example forward. in terms of the work that we're doing here around sex and gender within military members and veterans, with CIMVHR, of course, taking a leadership role around that through funding that's available to them and then spread out to the wider community.
Thanks. Jennifer?
Yeah, so,
oh, sorry.
Okay, I'll go ahead. I'm really pleased, obviously, that CIMVHR has organized the symposium today, and I'm hoping that it's sort of a new beginning for how things will be handled. I'm hoping that CIMVHR can work towards integrating GBA+ and the sex and gender-based analysis and SAGA principles into its work moving forward. So this would mean things like integrating these tools into, calls for funding, proposals, call for papers, submission guidelines for the CIMVHR journal, the Journal of Military, Veteran and Family Health Research. And so I think that would be a really productive way moving forward to make sure that this is not just a kind of one-time thing we're doing, paying attention to sex and gender, but how can we sort of embed it in and entrench it in the structures of the work we're doing and that CIMVHR is doing. Another thing I think that would be helpful is to create opportunities for learning, for mutual learning for the CIMVHR community. What kind of, I guess we'll have to find out what people are most interested in, what they would find most helpful, because it's hard to do on your own, right? It's often a new skill that has to be learned. And so I think it's okay to acknowledge that that's difficult. Even I find it difficult some days to do sex and gender-based analysis. That's a normal part of the job. And so kind of creating opportunities for mutual learning and exchange. Again, I already said this, but I'll say it once more, having the voices of those we study, and especially if those have been underrepresented, included in meaningful ways. We often say that the best policy is made when the perspectives of those impacted by the policy are included. And I think the same holds true for research, right? So the best research is going to be the one that actually is informed by the needs and voices and experiences of those for whom it is being conducted. And I guess just my very final kind of takeaway is, I think, to think about research and what we're doing as a collective research community as part of culture change, the culture change we're all talking about and working towards in the Canadian Armed Forces. I think research is a really key tool of culture change that has been neglected so far, right? We sort of see the institution trying to implement culture change, but Jennifer probably could speak to this as well, how much kind of the research that is being done in the department is part of culture change. And I think those of us who are outside of the institution also have that role to play. So, I think I'll just put that idea out there to think of your research as one of the tools of military culture change, even if you're on the outside.
Jennifer.
So, I wanted to add a little bit to the point about partnerships, and we work within a governmental structure, and we do our best with the tools that we have available at our disposal. So for us, the partnerships are really important as well, because we're not always best situated to be looking at some of the issues. Some of the people whose voices we need to hear don't necessarily feel comfortable having us being involved in that research process. So, I think the key piece is just being able to listen to the different perspectives and not being, as a government researcher, stuck in the government research world, looking outside to seeing what's being done. And I think CIMVHR has been really great in that it's allowed us to reach out to academic communities and learn from the work that they've been doing and try to integrate some of the principles that they've kind of brought out into some of our own research. And also, I mentioned earlier, we started kind of really trying to engage more with our defense advisory committees to get a broader perspective on the research that we're conducting. And we're really early at the stage in doing that, but it was such a valuable thing. Going forward, I think we really need to do that and continue doing that in a almost like just automatic way. First person, like, let's go, let's talk about this, and let's get your input on what we're trying to do. I think that's going to be really useful going forward and making sure that that we can do justice to the topic.
Thank you. I'm going to use my moderator's prerogative and throw in one as well, if I can, that you've all just inspired. And that's, recognizing that so many in our audience today are also professors and instructors and teachers, and just to think about how this is being reflected in curricula. And, from my own experience, it's very challenging to be presenting concepts like this to people who are hearing them for basically the first time at either middle or later in their career, having gone to the best schools, gotten the best education, often done PhDs at fantastic institutions, and then introducing this idea that there, people's genders affect their lived experiences, including in war and in peace, et cetera, the whole element of it. And so the earlier that we introduce this to students in particular at military colleges, universities, et cetera, around the world, I think the more receptive over time our audience becomes, and more curious, and the research is much enhanced. But as I'm sure you all know, it's very challenging to introduce this from scratch to many people, especially given the cultural context that we all live in. So to all of you who are professors and instructors, I very much appreciated the questions about resources available, including in French and in English, and to all of you for sharing your tools. So we are going to wrap up. I want to thank each of you panelists for very thoughtful presentations and very thoughtful responses to the questions that came in. I know you're putting a lot of work into this and will going forward, so we really appreciate that. And thanks to our organizers and to all the panelists who participated today. As we mentioned, and as Stephanie has been responding to people online, this video will be available online shortly, as will the PowerPoint slides. So I'm going to turn finally to David Pedlar, who is going to close us out. And this is the end from those of us speaking right now on your screen, but wanted to say merci beaucoup. Thanks so much to everyone for participating today.
You're welcome.
Thank you for logging in to our Sex and Gender Symposium. CIMVHR is dedicated to advancing sex and gender research and mainstreaming practices across all of our activities, including this symposium series. I want to extend a special thank you to Ambassador Jacqueline O'Neill, Dr. Maya Eichler, Dr. Jennifer Lee, and Dr. Margaret McKinnon. Your expertise in this area has been educational for all of us. I would also like to take a moment to thank Sunshine Coast Health Center for sponsoring today's event. We are grateful for your continued support of CIMVHR and for your commitment to helping serve those who serve us. Before we go, I would like to add that CIMVHR will continue to host events, whether virtual or in person, that focus on advancing research on important and current themes such as sex and gender. This topic has many areas we can focus on, and we will continue to build on this first symposium to further the conversation. Thank you very much.